All righty, well, good morning, everyone. Thank you for being here. Welcome to First Aid. We're excited to have you all. This is an ongoing series that we're doing here at the Carlson College of Veterinary Medicine. So this is our third event, and we plan to continue them and keep them going throughout the year and beyond. We have animal lovers from all over the country. Also saw some Canadians in the chat, so welcome online, and thank you all for being here in person as well. My name is Jens Odegaard. I'm the Director of Marketing here at the Carlson College of Veterinary Medicine. Here at the college, our mission is to advance the health of animals, people, and the environment through inclusive and equitable education, research, and services to the public. We have 331 students, 300 studying for their doctorates of veterinary medicine, and 31 graduate students in our comparative health sciences program. We serve the public through research and direct clinical and diagnostic services through our teaching hospital and our diagnostic laboratory. A few housekeeping notes for today's presentation. If you're in the house, please hold your questions to the end. We'll get to as many as we can. And if you're online, there's a chat box there at the bottom and a Q&A section there that you can put your questions in. And we'll be sure to get to as many of those as well at the end of the presentation. I'd now like to introduce today's presenter. Dr. Brianna Beechler is an assistant professor of research here at the college. She holds a PhD in disease ecology as well as a doctorate of veterinary medicine. Her research interests seek to understand the role of host physiology and immunology in disease transmission. She works with a variety of wildlife and domestic animal species, including African buffalo, bighorn sheep, walrus, cattle, and domestic cats. She's widely published, and her work with colleagues here at Oregon State landed the cover of Science magazine in October of last year. In addition to her work here at the college, she's an avid trail runner with her dogs Pippin and Jada, and she competes in backcountry ultra marathons. So please help me welcome Dr. Beechler.
All right, are we still good on the microphone? Yeah, cool. Another housekeeping note, if Jada gets up to come greet you, she loves all people and I'm sorry. Can't always control her. You wanna make it that, yeah. This. Okay, so I'm Dr. Beechler. As you just heard, this is Jada, my dog, who's going to demo some things for us. My other dog on the screen is Pippin, and I'm going to talk about preventing, identifying, and treating common dog injuries on the trail. So you may wonder, given those research interests you just heard, which sound pretty varied, why I'm doing this presentation, and the answer is Jada. The answer is she is the most accident-prone trail dog I've ever owned in my life. I've owned quite a few. And so her wide variety of injuries inspired me to think of a way to communicate to the public what you should do when your dog is injured by any creative way it's come up with to kill itself on the trail. For example, this is Jada in the middle there, showing me how miserable she is with her e-collar on. I recommend everyone has an e-collar at home, because if your dog spends much time outside, at some point it's gonna have an injury. You're gonna wanna stop it from licking, and having a collar of some sort to stop that is a great way to do it. But on the right side of your screen is a demonstration of when Jada decided to fight with a nutria. She lost, and you can see the bite wounds on her neck. And on the left side of the screen is when Jada fought with a stick and impaled herself in the abdomen. She also lost and then had to have sutures put in. But in all of these, we still had to come out of the woods after it happened. And so that's where this presentation comes from today. Before you go into the trail or go into the woods, there's some things you should consider or think about, which are pretty basic, but they're wise to remind yourself, because they're not always things we think about. One is fitness. It's important for you and it's important for your dog. Don't expect your dog to jump off the sofa and run 20 miles without injuring itself if it doesn't run regularly. Just like with us, we start slow and work our way up. So make sure your dog is trained for whatever activity you want it to enjoy, and that you didn't just jump full speed into something your dog wasn't ready for. Another thing to consider is your innate dog ability. Not every dog is meant to run ultra marathons. Jada and Pippin can run 40 or 50 miles with me. If I owned a French Bulldog or something with a flatter face, a brachycephalic breed, that probably wouldn't be the dog I'd choose to run 40 or 50 miles a day with. They just don't breathe as well. They're more susceptible to heat. So just consider your natural dog's ability. Another thing to consider is what the terrain you're going to be in and if that's suited to your dog. So on the bottom left there, we have a picture of Kia, my mother's old dog, in the snow, enjoying her day. She's a husky, she's meant for this. And on the right, we have one of my friends carrying his poodle out of the woods because she got so much snow stuck in her fur, she couldn't move her feet. She couldn't actually move her legs. So that fur was not suited to the snow, which he learned the hard way, carrying his dog 7 miles down a hill in the mountains. And a little bit later, I'm going to demo some dog carries too, because there may be a time when you have to carry your dog out of the woods, and depending on size, that can be challenging. Okay, another thing to consider and make sure you're good at is behavioral training. Make sure whatever behaviors your dog needs to exhibit on the trail, in the woods, outside, you plan beforehand. So if you're gonna have your dog off leash, then make sure your dog knows how to be off leash, that when you call it, it can come. If it doesn't have recall and you're gonna keep it on a leash, that's great too, but make sure you have it on a leash or a collar or a harness system that it's comfortable on and you're comfortable on. I'm gonna show you some things that I do with my bad dogs later, but just make sure you've thought about these things ahead of time. And another really important, that's why you were running. Another really important concept is that in the woods, there's often dangerous wildlife, venomous snakes, bears, cougars, coyotes, foxes, apparently nutria. So make sure your dog is trained not to approach that dangerous wildlife or know how to respond if so. I'm going to talk about what to do if your dog gets bit by a venomous snake. Hopefully your snake didn't get bit by a venomous dog, that'd be terrible. But when I do talk about that, the best prevention for that is to train your dog not to approach snakes. And there are lots of dog trainers out there and classes out there for those specific activities. So if you live in an area where snakes are a problem or are common, and there are a lot of venomous snakes and you're not sure if your dog is going to come up on one, then make sure you've done one of those trainings or learned how to do it yourself so you can then train your dog. And there's a variety of trainings out there for that. But it's just something to consider before you go, not when you're out there and your dog's been bitten by a rattlesnake. Another thing to consider, depending where you're at, is what preventative health measures you should be taking, veterinary preventative health measures before you go out. So you need to consider other vaccinations than what would be a normal part of a dog series. For instance, here in the Willamette Valley, I recommend that any dog that's going to drink out of rivers, lakes, ponds, streams, or puddles gets the leptospirosis vaccine in addition to its normal core vaccine. We do have leptospirosis here. It can be life-threatening in dogs, and there is a vaccination for it. However, it's not necessarily part of every core package at every veterinarian's office, so make sure you know to ask and talk to your veterinarian about a plan that works for your dog in the area you're in. And I know we have people from all over, so I don't want to get too specific here because it will vary depending on location. And then another good consideration is tick prevention. Almost everywhere now, ticks are a problem. So consider having your dog on tick prevention when it's going to be running around the woods. I have Jada running through what I would consider the best tick habitat I've ever seen in that photo up there. And so she is on tick prevention year round so that when a tick bites her, it dies before it can transmit any of those nasty tick-borne diseases that we've all heard of, Lyme disease, Ehrlichia, Anaplasma, etc. So make sure wherever you live, you've spoken to your veterinarian and made a plan that is appropriate, preventative health plan that is appropriate for your dog in the situation you're in. And it's not necessarily what you would do if it's only a core normal house pet. So make sure you talk to your vet about that. They don't know what you use your dog for unless you share that information. Another strong, important thing to consider is route selection. Think about where you're going and what environmental hazards your dog will face before you leave the house. So is your dog going to be running on sand? So you need to think about foot protection. Is your dog going to be on snow or ice or lava rock in Central Oregon? Is the lava rock going to be hot? All these things that could be important for dog paws. And on the other side of that, it may be warm out. Is there going to be access to water that's frequent enough for your dog along the entire route? And if not, what are you going to carry and how are you going to carry enough water for both you and your dog? Dogs need to drink just like we do. And then make sure that water is safe wherever you're taking them. So it's just some things to think about before you go that are maybe a little different than if you're just taking yourself hiking, although you always wear shoes, hopefully. So really the biggest difference is foot protection for your dog. Okay, so things to bring on a day hike or run are obviously a leash and harness or collar, whatever system you normally use. Some sort of dog identification, so make sure that collar or that harness has an identification tag on it with a phone number you can be reached at. I'm a strong proponent of microchipping. You don't know what might happen in the woods. Your dog might escape, it might run off. And if you have a microchip, it's much more likely to be found. So definitely microchip your dog. And then depending where you're at and how prone your dog is into running away, they make all kinds of fancy GPS collars now, Fi and various expensive versions thereof, where you can then track your dog on your phone if you do lose it, just like they've always done with hunting dogs. And so if that's a concern for your dog, it's something to consider. And then you would take appropriate foot protection and appropriate temperature protection, which means if it's going to be cold out, bring a coat. If it's going to be hot out, make sure you have water. And then your first aid kit for dogs, which I have a demo of up there. And then I believe you have a very nice handout that came from out there that you can also access if you want. What should you have in a first aid kit? It's actually pretty similar between humans and dogs. So what you should be carrying for yourself is what you should be carrying for your dog. So something to treat minor wounds on the trail, something to rinse them out. So I like to carry saline solution because it works for both eyes and rinsing wounds, but you can carry whatever you'd like. And then some sort of wound cleaning solution, like those white pads that you can get in human ones, betadine ones, hydrogen peroxide would work. Alcohol wipes. I don't like alcohol in pets because it stings and that's going to make your animal react. But I mean, in a pinch, it would work to disinfect the wound. And then some way to bandage that and or apply antibiotic ointment if you need it. Antibiotic ointment for humans is safe for dogs. Just try to prevent them from licking it. So don't put it on the wound and then leave it alone, but it's perfectly safe to put Neosporin on a dog wound. And then I like to carry things in case of an allergic reaction. So diphenhydramine or Benadryl for allergic reactions if necessary. And I have a dose later for you. And then I carry the normal instruments that you carry in any first aid kit, tweezers to pull out ticks and thorns, or a Leatherman, pliers, whatever you want to carry would work just fine too. And some sort of scissor implement to cut bandage material. Bandage scissors are great because they're multi-purpose, but really up to you. And then for your dog, there's a few extra gear things that I carry, which is always an extra leash, a small slip lead. It can work as a leash in an emergency, like I lost mine or dropped it down a cliff or it floated down the river. Or it can work as a muzzle. Dogs in pain will be unpredictable. Even your favorite dog in the whole world who loves you intently and would never bite anyone may bite when it's hurt. So if you're going to be trying to do something to your dog when you're in the backcountry or on the trail or in the woods, I recommend restraining its mouth if necessary, so muzzling it. Even Jada, who loves everyone, when I had to remove a torn toenail from her foot, which hurts, right? If you've ever taken a hangnail off yourself, it's not pleasant. She doesn't know what's happening. I pulled it off and she would try to bite me. So it's just important to remember that dogs in pain are unpredictable. And then dog booties, if they're not wearing them, I like to carry one because they're the best foot bandage material out there. Okay, so let's do some demos on Jada. You're gonna have to change, but yeah, I'll let him change the camera. Jada, it's your turn. Come here. Good girl, I know, you're like so scared. Okay, here's your treats. Perfect. You still hear me? Wait over there. Okay, I'll just try not to make it so feedbacky. Okay, so this is Jada. I guess we'll start with a couple of the things I wanted to show you. So I talked about harnesses or collars. One of the important things with harnesses is that this back strap here isn't all the way in the armpit. Because if it's all the way in the armpit, you're going to get rub marks that you have to deal with when they're running. And different harnesses fit different dogs differently. So you just have to find one that fits your dog. Another thing that some harnesses have that's kind of nice is a handle on the back, which helps you if you need to pick them up or move them or lift them over things. So you can consider that if you care about that option. And then when I said every first aid kit should have a slip leash, this is what I meant here. So this is a slip lead, your standard veterinary 99-cent or less slip lead. You can use it as a leash if you need to, or you can tie it onto their current harness, or you can use it as an emergency muzzle if you need to, and Jada lets me. I know, it's so weird. Life is so hard when you're a dog. So there's a lot of options for this, and it's just small, light, and useful. And then the other thing was a coat, a first aid kit. Here's an example of one here. And then a bootie. And I said booties are important because you may need to bandage a foot. And I just wanted to show you what I like about some booties. So Jada hates her bootie. She only gets her foot bandaged. But when I put this on, you can buy these cheap ones at the store that don't have a strap on top. And dogs have different size feet. And so it's important to have some way to adjust that depending on the situation. Or if there's a bandage under here and I want to put that over the top, it's nice to have that flexibility. So some of those cheap rubber ones are not really worth it, but they make lots of nice dog booties out there. I know, it's terrible. Thank you. Okay, here, sit down for a second. Okay, so how are we going to examine our dog in an emergency if we need to? The first thing is to know what's normal for your dog. So I've looked at your dog at home and know what to expect. So this for Jada, it would be a little different than say for my other dog. But in general, a normal rectal temperature. So every first aid kit should have a thermometer in it, and I should be able to stick it in the dog's bum. Every rectal thermometer has a little metal prong. When I'm taking the temperature, I need to get that metal prong all the way in the bum. I don't need to see any sticking out. And so that rectal temperature should be less than 103 in a normal dog. Remember, a normal dog is warmer than us. So when you see a temperature of 101, totally normal, no need to panic. But that rectal thermometer is important for if your dog is going to overheat. And so then you can test how bad it is. And I have some slides for that later. And then you can do a heart rate and a respiratory rate. There are many, you're probably not going to be carrying a stethoscope in the middle of the woods. So how do you get a heart rate and a respiratory rate? You can usually see them breathing. So you can watch the chest rise and go down for a respiratory rate. You can count for a full minute. So I have breaths per minute up there as a normal, or you could count for 30 seconds, multiply by 2, count for 15 seconds, multiply by 4, you can do the maths. But you could do that. If you can't see them breathe, sometimes you can put your hand on the side and feel it. And sometimes you can put your hand in front of the nose and feel those exhales. Those are all ways to get a respiratory rate. For a heart rate, most dogs, if they're fit, you can feel their heart if you put your hand, I know, your life's so hard. Inside their left armpit, so the heart is closer to the side, or closer to the side of the body wall on the left side of the dog. So go to the left armpit, stick your hand right inside here, right in the armpit with my palm against the chest, and I can feel her heart beating. So I could just count it. 1, 2, 3, 4, 5. That's her heart right now. If I can't feel her heart for some reason, I could try to get a pulse. It can be hard in a dog, but one place to do it is the femoral artery, which is in the back leg here. So it's on the inside, all the way up in where her abdomen and her back leg come together. And so you have to stick your hand pretty far up in there to feel it. I think it's a lot harder than just feeling the heartbeat, but it is something you can look at and try finding at home if you want. I think, oh, there it is. Okay. Another thing you're going to do when you're in the woods is your dog may have an injury, and so you want to evaluate how bad it is. So what are you looking for? A couple things. I usually would start with the head because most really big, important, vital injuries, the head is where you're going to notice some things that are wrong. So when I'm looking at, can you face them for me? I know your life's so hard. Oh, I know you have treats. Come here. You sit. You can do it. Sit. I know, good girl. Okay, when I am looking at her face, I'm trying to make sure both of her eyes are symmetrical. So both the pupils are the same size. One's not squinting, like she doesn't have eye damage. There's not a ton of discharge coming out of one, anything like that. Her eyes look perfectly the same to me. The left one matches the right one. And then the next thing I'm looking at is her nose and mouth. I'm looking for any discharges. She doesn't have excessive snot. There's no weird things coming out of her nose. There's no seeds in it. I'm looking at her mouth, make sure there's no blood or anything coming out of her mouth or nose. I will look at her gums to make sure they're nice and pink. That's a normal gum color for her. If they go pale, it can mean blood loss or shock. And if they get too dark, it can mean that they're dehydrated or overheating. So make sure you look at your dog's gums at home because every dog's gums vary a little. So it's good to know what's normal. Another thing you may want to watch for is excessive salivation. So lots of drool. It could be a sign that they ate something bad or they're feeling nauseous. It's hard to assess, say if you have a St. Bernard, which drools like everywhere, but in Jada, who doesn't drool, it'd be easy for me to notice that she has excessive salivation. Yeah, one treat. Good. Don't even think about it. You're gonna do that. Okay, so that's the face. And then you're gonna wanna check the rest of her body. Often if she has abrasions, wounds, or thorns, you're looking elsewhere. So you can always check ears, thorns, and seeds like to get stuck in ears. So open them up, look down in there. Another good note is make sure your dog is used to you manipulating their ears, their face. So you can do these things if you need to. You can look in both ears, make sure they look normal. You can rub your hands down your dog, see if you feel any swellings or wounds, if you notice any problems like that. When you're here. Thank you. When you're feeling legs, so they're limping, we're gonna go over that, it's a common problem. Your dog comes up to you, it's limping, you're trying to figure out what leg hurts because dogs are confusing sometimes. You'll wanna feel all the legs if they're limping on one leg because it can be confusing which leg is actually hurt. And so you'll wanna run your hands from either hip or shoulder all the way down the limb. And you're feeling at the joints, especially for swellings or wounds, or if the dog reacts to me and goes, oh, that hurts a lot, then I'll know. You're gonna wanna closely look at every paw. I say like 80% of the time when they're limping, they got something in their paw. So you're gonna wanna spread their toes out. Thank you, Jada. And look between every single toe and look on top too, between every single toe. And then you can also look for torn toenails this way. And then you can also, if you're not sure, kind of push a little, move these joints around and see if anything hurts, and it'll help you figure out what's wrong. And you can do that with both front and back legs. Okay, let's go. Okay, so I said you may have to carry your dog out of the woods at some point. So what are some possible carries? It depends on the size of your dog and how strong you are and the terrain you're walking on. This is where harnesses with handles can be helpful sometimes, but when you're gonna pick your dog up, you wanna make sure you can see this curve right here of her back leg. You wanna put one arm right underneath that, set nice and deep underneath that curve. The other one right up under her chest, not under her neck, but under her chest on her front legs, and just lift. And you can carry a small dog, or I can carry Jada like this for quite a while. I've carried her for actually miles like this once, it was terrible. So that's one way. Some dog, depending on the sizes, you could carry like this on your hip, like a child, depends on the dog. You can carry them, not gonna do this with Jada because I'm not that strong, but you can carry them over the shoulders like you see in that photo. The top one is Henry again, the poodle in the snow. And the bottom one is my brother carrying his dog after she ran her pads off and to hike her out that way. If you are not as strong, or you may be hiking further, or the terrain might be uneven, you could consider they make a bunch of commercial slings that you can purchase for dogs. I put an example of one up there where essentially the dog has in a sling and then you have a backpack strap to carry them, which would be an easy way to carry a big dog. It depends on the size of the dog. Small dogs, they make front carriers, they make side carriers. You can put a small dog in a backpack. Be creative, but think about if the worst were to happen and you know your dog and the size of it, how you would carry your dog out if needed. Thanks, Jada. Want to get down? Come on. It's your bed. Good. Okay. Yes, okay, so that ends my Jada series, and I'm gonna go back to speaking like a normal human. Also, I just got my workout for the day. Yeah. So now I just have a series of slides, which is what do I do when? And I picked some of the things that I think I see a lot, like they're super common, so you may wanna think about how to respond. There are lots of others. There's no way this is inclusive at all. But okay, so what do I do when my dog is stung by a bee? The first thing to remember when your dog is stung by a bee is that most dogs and bee stings are not life-threatening. It's like it is with us. It hurts, it's annoying, you're not very happy about it, but it's not the end of the world, the dog will recover. Most reactions are mild. They may swell at the site. There's some pain, but they'll be fine. They can have severe allergic anaphylactic reactions, just like we can. So that can be a concern with certain dogs. And so you may need to treat that. And that's where something like Benadryl comes in. But in general, your dog gets stung by a bee. I'd say step one is to get the dog to you away from wherever it is. At least here, I feel like every time Jada steps or gets a bee on her, it's because she just stepped in a yellow jacket nest. And if I go up to her, then I'm gonna get stung by the 7,000 bees that are now swarming her. So I usually try and get her away from the nest she just stepped in. So once you've done that and you're in a safe spot, check the site. If you can figure out where the bee was, you may need to remove the bee. If your dog has long fur, sometimes bees get stuck in the fur. So you may want to use your tweezers or a multi-tool to pull it on out. If you see the stinger, grab it just like you would in yourself. And then you treat the bee sting exactly like you would a bee sting in yourself. Wash it off. Cool water can be soothing. It feels good, just like it does for us. So it might help the dog. And unlike you, who probably doesn't lick or chew your wounds, make sure your dog doesn't lick or chew at the bee's injury site. And if you're worried about your dog having an allergic reaction, then you can administer oral antihistamines like diphenhydramine. Benadryl, perfectly safe for dogs. That's the brand name, but you can purchase off-brand. That's fine too. The important part about purchasing diphenhydramine, and I say this because I've seen this in the clinic before, is that they make some called like Benadryl daytime, which has caffeine in it, and that caffeine would be toxic to your dog. Or they make some that are like Benadryl for sleeping. It already makes me sleep, but apparently extra sleeping. You wouldn't want to do that one because it has extra compounds in it that could be toxic to your dog. So make sure it's regular old school diphenhydramine. The dose is 1 milligram per pound of dog, and each adult tablet is normally 25 milligrams. So a 25-pound dog takes 1 adult tablet. And it's perfectly safe. But like I said, most of the time, dogs don't need Benadryl. Most of the time, they're going to recover and be just fine, and you just treat it like a bee sting in yourself. This is an example of facial swelling. So when I say, when should you be concerned? This is a dog who got stung in the face and now has a very swollen face. This could make it hard to breathe. This is an early sign of an anaphylactic reaction. You would definitely want to treat this dog for that. An important thing to think about is when you give oral Benadryl, like after a bee sting, it's gonna take it like 30 minutes to take effect, right? It's gonna take a little time. So if you're really worried about it, you want to give it right away, especially if your dog's ever had a reaction. And if you see any facial swelling and you can get out and get to a vet, do it. At the site, the other times you might see a vet is if that site of the sting, like a few days later, is swollen, still swollen, or it's weeping, or it looks infected, then you'd want to think about going to a vet later on because there's probably secondary problems from that bee sting. Most of the time, bee sting's not a big deal. On the other side of that is, what do I do when my dog is bitten by a snake? First thing is it a venomous snake? You know, your dog could have been harassing a non-venomous snake and got bit by a non-venomous snake, and then you just treat it like you would any wound. You don't know that necessarily. I put 2 pictures up here to point out some differences between venomous and non-venomous snakes in most of the US. This would be different if you lived in a place where coral snakes live, not here, or if you live in most other countries. But here, most of our venomous snakes are rattlesnakes, and they have some very distinct characteristics. And one of them is they have this very triangular square head. And that's because their venom glands are located right back here at the back of the head. And so when you have this triangular head, that often means a venomous snake, whereas this one, there's no triangular there, right? That's a straight line, there's no venom glands. That is not a venomous snake. The one on this side, I believe, was a gopher snake. This is a rattlesnake. You could look for the rattle, but be prepared to know that even like gopher snakes and bull snakes like to pretend they're super tough rattlesnakes, so they may trick you into thinking they have a rattle when they don't. And then another difference that you're hopefully never close enough to see is the pupil. So non-venomous snakes have a round pupil, just like dogs, whereas venomous snakes have a slit-like pupil, so a long slit-like pupil. When dogs get bit by a venomous snake, it's not an immediate thing necessarily most of the time. Signs can take up to 24 hours to develop, so you want to monitor your dog for quite a while after a snake bite. Things to look for are sudden weakness, excessive drooling. You can look for the snake puncture wounds, you might get lucky, and or restlessness. The best treatment for a snake bite is to get it to a vet so that they can get antivenom. So you may not want to wait, you may just want to kind of hike out when you can. And then bites to the abdomen and chest are often more severe than to the limbs. And also smaller dogs are going to be more of a risk than larger dogs. So what do I do when my dog is bitten by a snake? One, move to a safe area. Doesn't do anyone any good if you get bitten. Do not try to catch the snake. Just don't do it. Do take a picture from a safe distance. Use the zoom function on your phone, works great. That way you can identify it, or when you get back to the vet, they can identify it for you. Be calm. So when humans get bit by a snake, they tell us we don't want to elevate our heart rates, right? Because it spreads the venom faster. Same trick for dogs, but dogs are going to feed off you. So if you're busy panicking, your dog is going to get busy panicking, and that just spreads the venom out faster. So be calm, don't panic. You can rinse that wound with water if you see it and get to veterinary attention as soon as you can. If it's feasible to carry your dog, it would be good because it lower their heart rate, keep the risks of it moving very fast better. And if it's feasible, you can keep the wound below the heart, which works really well in a paw or something, because that's like the natural position for legs. The best treatment for snake bites is don't let your dog approach snakes. So train your dog to avoid snakes. And dogs are like super way smarter than us, right? So they don't need to see the snake to know it's there. So most of those snake training classes train them to detect smell or sound in addition to vision. So they may notice the snake before you notice the snake. And if it's trained to avoid it, then it won't get bitten. Okay, so that was snakes. Now we're going to talk about what to do when they're overheating. This is probably the most common thing next to like wounds on the paw that you're ever going to see on a trail. It's important to remember that dogs can overheat when running about and being crazy animals, even when temperatures are like 70 degrees or mild. So just because you're very comfortable doesn't mean your dog is very comfortable. And remember, most dogs are not really good at stopping themselves when they should stop, especially if you say have a herding dog with like no ability to slow down ever. So most dogs won't regulate themselves, so it's up to you to keep track of their temperature and make sure they're not overheating on hot days. Some dogs are more sensitive to heat, so knowing that about your dog will help. Again, older animals, unfit or fat dogs are more sensitive to heat, and brachycephalic, the squished face dogs, are more sensitive to heat. There's a couple categories here of when to panic. Mild hyperthermia, so body temperature under 105, and that's rectal body temperature. So that's, I put the thermometer in the butt temperature. That a temperature under 105 is not necessarily life-threatening. You want to cool your dog, whereas a temperature above like 105, 106, that's, you want to get to veterinary attention and cool that dog ASAP. The best predictor of whether a dog survives severe hyperthermia is time till veterinary care and cooling. So it becomes really important. So most of what I'm going to talk about in the next slide is mild hyperthermia. So what you can do when it's just mild. So the dog is too hot, but not life-threatening yet. Signs of hyperthermia are, you all know this, thirst, seeking shade, panting that doesn't improve, bright red gums or tongue. And you can see that in this photo I have in the middle of 3 of our dogs on a trail run. Alex in the middle, his tongue is pretty bright. It's not brick red, so I'm not nervous yet, but it's getting pretty bright. And they were definitely overheating. They were seeking shade. They were trying to get out of the heat. And so we had to pause and sit under a tree for 20 minutes on a run because the dogs were overheating. It was hot. But it's something to keep an eye out for. If they stop peeing or if the pee turns like that dark brown color. So what do you do when your dog is overheating? Stop exercising, step 1. Move into the shade if you can. Cool that dog by soaking the hair with water. If you're next to a puddle, they can get in a puddle. You're next to a river, put them in a river. If you have to soak them with water from your water bottle, do that. Get them as wet as you can and try and cool them off. You can encourage drinking, but don't force them to drink. That's not going to help. You'll just make them aspirate the fluid and then they'll have bigger problems. So give them water, but don't make them drink it. Put it on their fur, cool them down. You can stop cooling when their rectal temperature drops to like 102 and resume your activity. Severe hyperthermia, like I said, that rectal temp that's like up there in the 106 zone, you should, I mean, you can try cooling them, getting them in cold water, but you should also get out ASAP and get veterinary help because they probably need IV fluids and whatnot, treatments for severe hyperthermia. Okay, what do I do when my dog has a wound or cut? So they're, of course, very common. We've all seen dogs with wounds or cuts. The picture on the left is when Jada cut her paw on a piece of glass in Willamette Park. And a picture on the right is my parents' dog when he tried to go under a barbed wire fence and did not succeed. So the first step when your dog has a wound is don't let the dog lick it. It's gonna make it worse. So stop the dog from licking. And then apply pressure if it's bleeding. So just like in us, if you want to stop a wound from bleeding, hold it off. And then once it's done bleeding, clean it up real well. Use your water or your disinfectants, clean it out. Make sure you clean it with whatever your disinfectants are that you have in your first aid kit, iodine wipes or whatever they may be. And then you can use that antibiotic ointment again. So Neosporin is perfectly safe. And then bandage it up if you can. Obviously, if it's on a paw, that's where booties come in. They're great. You can put that booty right over the wound and hike out. If it's on the back, like it is here for Tango, that'll be very challenging for anyone to bandage. So it'd probably just be try and stop the dog from licking it and get out and then have the vet help. If it's a laceration through all layers of the skin, so it's gaping open, like in Tango's wound up there, you may want to seek veterinary care when you get out. So sutures or staples might be needed. But if it's just a minor scrape, not through all layers of the skin, you can just treat it like you would a wound on yourself, monitor it, put some antibiotic ointment on it, don't let the dog lick it, use your e-collar and see if it heals. You would want to go to the vet if it gets worse. So you see signs of infection or something like that, but most of those minor wounds heal on their own. Puncture wounds, so they stepped on something like a thorn and it went straight in, like to get infected, like a lot, because they don't drain very well and they're really hard to clean. So you'd want to monitor those even closer and then go to a vet if they get worse. Especially if you see swelling around a puncture wound days later. That's how abscesses start. Okay, what do I do when my dog is limping? Dogs that are putting less weight on a limb, so are limping, are doing it because that limb hurts. So you're trying to figure out why it hurts. So the first step is what leg hurts, which is really easy if it's like a dog in one of these photos. So the boxer looking dog there, the brown one, holding his back hind limb up like that, I'd be willing to bet that's a torn cranial cruciate or torn ACL. They're usually completely non-white bearing in that limb when they do it. Whereas the border collie looking dog there is holding up his leg for you, his front left leg. And so this is pretty easy because they're holding them up and asking you to look at them. But sometimes they're just got a little hitch in their giddy up. They're just limping a little. And it can be really hard to tell what limb hurts. So when you're evaluating the leg, evaluate all 4 legs and see if you can find something even on the leg you didn't think it was, because you just don't know. Common reasons for lameness, often injuries or wounds to the feet. That's why I said the first thing you do is look very closely at the feet, look at nails, look at pads, look between the feet. It could be strains, sprains, ligament damage. These all occur in dogs. Torn cranial cruciates are pretty common. So if your dog went suddenly lame on a hind limb, like very acutely and won't put any weight on it, get to a vet, chances are high. And less common but more severe would be like broken bones. Those are much rarer. Usually it's a much more minor injury when your dog is limping. If it's mild, so the dog is putting some weight on the limb but has a little hitch, can't walk normally, evaluate that leg carefully. If it's a severe lameness, like the dog is putting no weight on that limb, it's just holding it in the air and won't let it touch the ground, then I would get out in any way you can and get to a vet when you're able. Because you'll only make it worse if it's like a torn cranial cruciate or a broken bone, let's say, by continuing to walk, make the dog walk on it. So get out however you can. You may need to carry your dog. So what could be wrong? We kind of did this with Jada, but evaluate that leg carefully. Check the pads, check between the toes for wounds or thorns. Like 50% of the time my dog comes up to me limping, it's because he has a small piece of gravel stuck between his toes because my other dog is a giant baby. So just check those feet really carefully. And then also look for torn toenails and for any swelling or wounds along the whole leg, like I did with Jada. And remember to make sure to feel all 4, even if you think you know which limb it is. So what do I do when my dog is limping and I found a wound on his pad or a torn toenail? The first step is I don't remove torn toenails in the woods. It hurts like a lot. I would let the vet do that under sedation with pain control. So I would just bandage that wound or that toe up. So I would do what I would with a wound, just like I find a wound on here. So the Jada foot here, so many Jada pictures, is a torn toenail. And this one here is a pad that got either burned on the hot cement or damaged somehow. It's not my dog, so I don't know. So you're gonna clean that wound up. You can use antiseptic again. And then bandage it up, place a booty if you have one, and then go to a vet when you can get home for evaluation. But yeah, don't remove those torn toenails yourself. It hurts like a lot. And I guarantee your dog will try to bite you if you do. If you must, There's probably some videos online you can watch, like if you're doing like wilderness first aid and you're back in the woods for 5 or 6 days, but I wouldn't recommend it on a day hike. And then I have some examples up here of Baron here, one of my friend's dogs with a nice bandage on. It's easier to bandage properly when you get home. It's really hard in the woods to bandage properly and clean. So clean it up in the woods, get a temporary bandage on or throw a booty on it like this. But then when you get home, you can get it bandaged properly until you can get to a vet. Okay, so what do I do, which is the other most common thing, when I find my dog is limping and I can't find anything? There's no apparent reason for it. You can do a couple things. If your dog is carrying a backpack, take the backpack off. Might as well not make it worse. Consider walking slower or shorter. And when you return home, definitely consider resting the dog and make an appointment to see a vet when you can. This is another picture of a dog with not putting any weight on the limb. So that's a very severe lameness in that back left leg. Okay, what do I do when my dog has foxtails, grass-ons, or thorns? Foxtails are pretty common. Foxtails, grass-ons, whatever you want to call them. They like to migrate and cause all kinds of problems. So if you see grass seeds or foxtails on your dog and they're still on the fur, grab them, get them out, pull them off, get them off the dog before they get in the skin. Once they get in the skin, you have to use tweezers or something to pull them out. And then you have to watch that wound very carefully because this is a puncture wound. And so they like to get infected. Don't let the dog lick or chew on it and monitor those spots. This is a full-size grass-on for you. So you can see they're very long. And what they like to do is get stuck between the toes. And then they like to migrate all the way up the foot like this. And so what you see on the right there is a very stereotypical grass injury where the dog has a wound right here where the grass-on went in. But if it didn't come out immediately, that grass-on's probably not still there. It's gone way up here. So those wounds typically require veterinary care. Because they need to flush out that drain tract and find out any material that moved around in that limb. So it's best to get those foxtails or grass-ons out of the fur as soon as you see them. If you can see it, get it out. I have a picture up here of Baron, again, one of my friend's dogs, who managed to get a grass-on that migrated into the side of his body wall and ended up having like $5,000 worth of 2 surgeries because the grass-on tried to migrate into his lungs. So they move, like these things move in the body. So they really are a problem and you don't just leave them there. He did recover to live a very long life, like 15 years. Okay, what do I do when my dog has a tick? One, don't read any of those stupid videos about how you're supposed to twist clockwise or counterclockwise or whatever else the internet might tell you to do. Just get the tick out of the dog. If your dog is on tick prevention, it really isn't a big deal if the head stays in. So I just grab that tick with tweezers or my forceps or whatever I have and just pull straight and pull it right out of that dog. If the head stays in, that's okay. Make sure your dog is on some sort of tick prevention like Bravecto or NexGard or Frontline Ticks, whatever you prefer. Talk with your vet about it because then your dog is unlikely to get a tick-borne disease when bitten by a tick, which is the real problem with ticks. It's Lyme disease, it's Ehrlichia, etc. After you've pulled that tick out, you can just clean that site up and monitor it for any problems, infections. Little bits of redness and irritation around the tick bite is very normal for 1 to 3 days. So if you Google like Lyme disease, you see that bullseye rash, that's huge just for comparisons. A tiny bit of a red circle around a tick bite is actually a pretty normal reaction in dogs. If you are concerned, go to your vet. Signs of tick-borne diseases are like signs of any other severe disease, lethargy, vomiting, not wanting to eat, diarrhea, joint pain. So if you have anything like that in your dog, go to a vet. And the last one up here is not really a health problem, but I put it up here because I have a favorite recipe because Jada finds a skunk at least 3 times a year. So what do I do when my dog is sprayed by a skunk? This is my favorite recipe. It's hydrogen peroxide, baking soda, and dishwashing soap. And the important thing is, I don't know if you know this, but skunk spray is yellow and it's in oil. And I know that because when Jada gets sprayed, she's white and I can see the yellow oil on her. It's disgusting. And so because it's an oil, just washing with water doesn't work very well. It actually just kind of spreads the oil out really nicely and makes it worse. So I don't start by washing her. I start by making the solution. I have to make 2 batches of it for a dog her size. And then I rub it in her fur and I leave it for 5 minutes. It has hydrogen peroxide in it, which will make a dog vomit. So don't let your dog lick it off after you put it on. I wait a few minutes and then I go ahead and rinse her off. You can repeat this if necessary, and you can use more dish soap bath after that. But that first step is this stuff, which gets that smell out of there. It neutralizes that smell pretty well. If you're quick, it works really well. If it's been 5 or 6 hours, it works less well. And I think that's all I have today. So we can switch to questions. My dog has gone to sleep. We'll start there.
So I guess my first question is, how would you check skin cells and then like if it were
Yep. So they actually make wilderness first aid classes for dogs. So you can take wilderness first aid for humans, like the licensed one, right?
Okay.
And then you can take wilderness first aid for dogs. It's actually pretty similar. The signs of shock and problems are going to be very similar in a dog that they are in a human. But signs of shock in dogs tend to be like pale gums, rapid breathing, fixed pupils, those sorts of things.
Okay, how would you check whether or not blood flow with this one? Like in humans, like, is there capillary refill?
I mean, you can try capillary refill. It's pretty easy in toes.
Okay.
If you go between the toes. But honestly, the best thing you're going to do in that situation is not worry about any of that, but get out and get that limb fixed at a vet.
Okay.
As fast as you can.
Dr. Boucher for online teaching.
Yeah, sorry, I forgot. I'm not very good at this. Go there.
Yes. So if your dog is overheating and you have limited water or ice packs, what's the most important part of the dog to cool down?
Yep. Okay. So the question is, if I have limited water and my dog is overheating, where do I put the water first? Yeah, or ice packs. If you have enough ice packs in the woods, that'd be cool. That'd be good for me too. So ears are good. Anywhere where there's a lot of skin, belly, here, anywhere you can get that water on the skin. If you think about what a dog does when it's hot, or at least my dogs do, they run into a puddle of water and then immerse their whole belly in it. So I think trying to mimic that would be best. There's not, I mean, you can put on paws, that will help some too. There's good heat exchange there. Anywhere that you can get good heat exchange, because the way the dog is going to lose the most heat is by the vessels that are closest to the skin are going to dilate, and that lets heat out of the body. And so if that's closer to the surface, it will work better. In front first.
I have a question about the booties.
Booties.
You're talking about are those
Hot rocks, yep.
hot rocks? No, do you put it on something before you just pull off?
Yep.
Is there a special kind that you use?
So the question is about booties and lava rock. So basically taking your dog anywhere in Central Oregon Cascades on the east side. And some of that depends on the dog. Do I use booties all the time? No, it depends on the toughness of my dog's feet and what they're used to walking on. If the lava rock is going to be hot, yes. Hot lava rock will burn the pads of the feet almost immediately. So if you're hiking with your dog up South Sister, booties are recommended. The booties I like tend to have a rubber type bottom like this. There's lots of brands out there. And then they make various ones with different treads and tractions. An important thing is if you're going to take your dog out in booties for a hike, that you've trained them to booties. So don't make the first time they wear them that hike. Make sure you put them on at home and done that. Here's the treats for being a good dog, so they don't just freeze like they all do when you first put the booties on. Yep.
I heard you say that if a dog's on a tick preventative and the head stays in, it's not that big of a deal. If a dog is not on tick preventative, is it helpful to put them on tick preventative afterward? Would that help that specifically?
I think it would still help. So the absorption time for most of like the Bravectos, NexGard, et cetera, is 4 hours, whereas the transmission time for most of the Lyme diseases, Ehrlichias, et cetera, are 12 hours. So that's how long the tick has to be attached before it migrates. Either way, I wouldn't panic about the head being in, but yes, I would recommend tick prevention. I actually really strongly encourage every dog to be on tick prevention if they're going to be out running around in the woods. We have great tick preventatives and they work. And I don't know, here at least, when I take Jada running, she's like the best tick collection device I've ever met. She comes out with ticks every time, even though I don't.
I'm going to take a couple from the chat online. So there were several questions about using blood clotting powder or something similar on the trail. So can you speak to that?
Yeah, so the question about blood clotting powder. Yes, they make several of those. They're like quick stop, basically. Like if you trim the nail too far, you can buy them in the pet store. Potassium permanganate is what most of them are. Those are perfectly safe to use. I wouldn't use them on a skin wound necessarily. Most of those will stop on their own, and that kind of burns, and the blood is actually bleeding a little, is good for getting bacteria out of there to prevent infection. But certainly for a torn toenail or something, that would be perfectly safe and good to use.
One more from the chat, and we'll come back to it in person. Several questions about porcupines, porcupine quilt. So let's jump to the bonus slide.
Bonus slide. I took this out because I wasn't sure I wanted to talk about it. So the question is about porcupines and what do I do when my dog encounters a porcupine? Jada's actually never been porcupine, which is a small miracle, and I'm waiting for it. But the most important thing when your dog got quilled, this is actually a dog that came into a clinic I worked at. You can see that it clearly tried to bite the whole porcupine, which is actually really common. So prevent movement of the quills. Don't let the dog paw it, rub on it, rub its face on the ground. You don't want those quills to break, move, or embed any further. They need to be removed. You don't just leave it alone, or they can migrate into tissues, cause infection, cause problems. The safest way to remove them is to prevent the dog from pawing at his face. Nothing in this dog is going to be a severe problem in the next 8 hours. So this dog can walk out if it needs to, or you can carry it out, get it to a vet and let them remove those quills with sedation and pain meds, because porcupine quills are kind of barbed. And I don't know if you've ever tried to pull one out, but it hurts. Like, it doesn't feel good. And so doing it at the vet is the safest way. If you must remove them on your own, you're too far away, something like that. There's all these things on the internet about wet them first. Don't do that, they'll just break off and even be harder to remove. Or cut them first. Don't do that, they're even harder to grasp with your pliers. Just take your pliers, grab the end of the quill. Where are we? Let's do it on this one today. Right here. So I would grasp right here at the end of the quill, and I'm going to pull straight and smooth the same direction the quill went in. So no angling, nothing like that. Just try and pull it out in the same track it went in. There. It will hurt. The dog will react. So be prepared for that, which is why the best thing you can do is have a vet do it if you're close enough to help to go do that. You don't need a twist. You don't need to do anything fancy like that. Just pull it out. And then go to a vet anyway, even if you pulled them out yourself, to make sure you got all the piece out. There's not a chunk left in there that's gonna cause infection, which is easier to see when the dog is sedated than when it's freaking out and you're trying to do it.
A safe pain reliever for dogs that our dog doesn't stop, and so I think he sometimes just has muscle soreness like we would if we ran too far.
Yep, so the question is about pain relief for dogs, what's safe for them, and muscle soreness. Yes, dogs definitely get muscle soreness, especially if you're on a multi-day backpacking trip, let's say on day 2 or 3, just like we get stiff and sore, they can get stiff and sore. I don't recommend any of the human products out there, definitely no ibuprofen, it's toxic for dogs. So what I would recommend if your dog needs pain relief is that you talk to your veterinarian before you go and get a dog safe medication. They make quite a few NSAIDs, non-steroidal anti-inflammatories for dogs, but they're all prescription, so you must get them from a veterinarian. And I do carry, personally, I'm a vet, so I don't have to go to my vet, I just get it. But I carry Carprofen Rimadyl in my emergency kit, so if the dog is sore, I can give it that on an emergency basis. But I don't recommend any human products. At the pet store, they like to sell aspirin, which is technically safe for dogs, but at the dose that it's safe for dogs, it doesn't really cause much pain relief. So it's just placebo. Makes you feel good, but doesn't necessarily help the dog. So I definitely recommend getting a safe one from your vet. We'll go there.
I just have a question about like Giardia. I have a young puppy who's got Giardia. We like haven't been anywhere yet. So do they just like go for immunity when they're older, or how do you avoid that if they're out hiking?
So the question is about Giardia in puppies. And here, Giardia is super common. Every puddle is going to have Giardia in it. Yes, some dogs kind of build up an immunity to it and don't develop diarrhea or clinical signs from it, even though they have Giardia. There isn't much you can do besides try and prevent your dog from drinking out of nasty muddy puddles where they're more likely to get it, and treating when it occurs. So visit your vet. You can try if it's like sometimes Jada gets Giardia, and I have tried probiotics and whatnot to help her gut around it while she's being treated. So you're going to get an antibiotic, and I will give probiotics with it. But there's not a lot you can do at home when they've developed diarrhea from Giardia. Once they've in that stage where they're pooping everywhere with the Giardia poop, which smells terrible, you need to get treated. And it should get better as your dog gets older if it's normal.
Chat real quick. There's several questions in there about Benadryl, how to dose, and sickness dogs, and are there alternatives if your dog's allergic to Benadryl, so maybe just talk to your dog.
Okay, so the questions.
Allergic reactions.
Questions are all about Benadryl. Let's start with, so the dose of Benadryl, like I said, is 1 milligram per pound of dog. Most adult tablets are 25 milligrams, so a 25-pound dog takes 1 tablet. A 50-pound dog takes 2 tablets. What's half of 25? 12.5? Yeah, 12.5-pound dog takes half a tablet. They do make children's Benadryl, which is cherry flavored and disgusting and it's an extreme challenge to get down your dog's throat, but you can try. So if you do have a small dog, the children's Benadryl is dosed lower, but it's always 1 milligram per pound of dog. And then the question is, what are the alternatives? There are lots of other antihistamines on the market. Many of them are safe for dogs. Many of the allergy meds we take are also safe for dogs. And so if you have a dog that can't have Benadryl and you're concerned about having alternatives, talk to your personal vet again about what the best alternative in that situation. Because it would depend on the dog allergies and the situation. But regular Benadryl is pretty safe. Okay. Oh, we're taking one more from the room. That's what he meant. I'm all with it now. Yeah.
Well, could they ingest something like, we had a dog in a toad, it's really sick.
Yeah. Yeah, what happens, the question is what happens if they eat or ingest something toxic? Good one. There's a couple options. Depending how close you are to a vet clinic, like if you're within like a half an hour or an hour drive, I would say go to a vet clinic. They have things they can put in the eye that make them vomit and get that out of there. That would be step 1. Step 2, also they can give them fluids, which helps a lot when you have some sort of toxic thing you've ingested. If you need to do it in the woods, there's a couple things people use to induce vomiting in dogs. One is a pill that's on the market in some places that we just looked up that maybe works. I don't know, it's new, I haven't seen much about it, but the old school method is hydrogen peroxide. And there is a dose. It depends on the amount of hydrogen peroxide. I'm trying to remember, I think it's 3% hydrogen peroxide, but you can look this up. This dose is very common. You can ask your veterinarian and you give it orally and then they vomit. Not every dog will vomit from hydrogen peroxide, so it's not my first choice of outcomes. I would try to get out and get a vet to do it first, but if it's not possible, hydrogen peroxide will most likely make your dog vomit. The risks are hydrogen peroxide doesn't taste good and you have to put it down their throat. And so if you put it in the wrong pipe and it gets into their lungs, you've made everything way worse. Aspiration pneumonia is probably way worse than the ingestion of whatever substance they got. So get to a vet if you can. If not, do hydrogen peroxide safely, but definitely consider the risks when you do it. Hear that the risks of like toads and newts and whatnot are real though. Should we take one more? Okay, one more.
I was just gonna say hydrogen peroxide, it's usually 1 ml per pound.
Thanks. 1 of 3% or 1.5%?
3%.
3%, thanks. Yep.
So, speaking from experience, going out that country, camp, pain would be.
Okay, yep. So the question is if you're going to carry anti-inflammatories or pain control for your dog in the backcountry, what should it be, pain or anti-inflammatory or what? My answer to that is most like soreness and injuries, like you're limping because your muscles hurt or your tendons are sore, is inflammation. That's why it hurts. And so reducing the inflammation will reduce the pain. And so most of the good dog pain meds out there, the carprofens, the galliprants, all of those things are NSAIDs, non-steroidal anti-inflammatories, which help both inflammation and pain. Okay, I think we're done.
Yeah, a couple things.
You guys throw me giving a hand for Dr. Beechler. Yeah, thank you so much for that. Super helpful. For everyone online and in the chat there, and everyone here in the house, we're going to be making everything available here at this website. So we'll have the recording of the presentation. If I get permission from Dr. Beachler to post all of her slides there, we'll put those there as well. She says yes. So those will be there. We will also have the first aid kit checklist that those of you in house got in person, but everyone else, we have a PDF online. We'll also there was a lot of questions in the chat, and we'll try and go and select through those, distill them down, and put some of the most frequently asked questions up there. We'll get responses from Dr. Beachler. We'll put that up there for you all as well. So thank you all for attending First Aid. Please check this website for future events. And we'll be planning more. We're thinking of doing some for disaster preparedness for pets, especially as we come into summer fire season in Oregon and the Northwest and beyond. So that might be our next topic. So stay tuned here. And don't forget to follow us on our social accounts. That's also a great way to stay in touch. And finally, for those of you in the area, we have Pet Day next Saturday. So please come out. Bring your leashed pets that are well behaved. If not, just come and enjoy all of the cute animals that'll be here. So thank you all so much. Take care.